Hi, everyone. Thank you so much for joining. Today, I will be talking with Dr. Tony Ingram, who is a biological dentist, an integrative health coach, and owner of Flourish Dental Boutique in Richardson, Texas. She's going to be on the show today talking about different controversial things in dentistry. But first, I just wanted to explain that she had her own personal health struggles with an autoimmune disease, and then she shifted her practice philosophy to focus on whole body health and the prevention and safer treatment of oral disease. She holds degrees from TCU and Baylor College of Dentistry. She is a member of the International Academy for Biological Dentistry and Medicine. She is a SMART certified dentist, so she's going to explain what that means. And then she also has a lot of other certifications, including integrative health coach from the Institute of Integrative Nutrition. And that one is particularly interesting to me because I also got certified through them. And that was how I first learned about functional medicine. So that was something that we have in common. And now she is actually my dentist as well. So I wanted to share her with you and have her explain more about what holistic dentistry is and how to avoid toxins and all that kind of stuff. So first of all, Dr. Tony, tell me why you went into dentistry in the first place, and then why did you leave conventional dentistry to open up your own practice?
Well, first of all, thank you so much for having me. I really appreciate it. These are fun conversations, and I am such a huge believer in functional medicine. So the fact that you are continuing the education and the nurturing of your patients' health knowledge is amazing. So I'm excited to share. Um, and my how I got started in dentistry was kind of an elimination of less fun options. So I knew I wanted to help people, but I also knew that I wanted to start a family before I was 30, ideally. And so, juggling the options of, do I go to med school? Do I not go to med school? I just didn't have it, Dr. Eagles. So I decided that dentistry was a more family friendly option for me. Now I want to hear your story too and see how you balanced it all, because clearly you were able to balance that and still survive. But I went into dentistry because I had a heart for healthcare. I always have. I have a lot of family members in healthcare. And so it's always been a passion of mine to help people in some way. And dentistry just happens to be the way that I do that. Now, I was a conventional, or I say a quote unquote normal dentist for a long time, and that was my only goal, was to just be a normal dentist and to help people. But I really found that I got a lot of burnout doing normal standard, what we call drill and fill. Well, we call it drill, fill, and bill dentistry. It's really, honestly, it got pretty discouraging because I would do these procedures on people and they would come back and they would need more, and we weren't solving the root cause of their issues. And so a lot of dentistry felt like I was spinning my wheels. But around the same time, I got sick myself. So, like you mentioned, when I was opening my first practice, so I'd been out of school for a few years. I was married, had a toddler at home, was working full time as an associate, was opening my own practice from scratch, and just got super sick with some gut issues that at first they were kind of poo-pooed by my doctor, and then my symptoms kept getting worse and worse. So finally they did a colonoscopy on me just because I kept bugging them so much, and I was starting to lose weight and wasn't trying to lose weight. So they're like, okay, but I guess let's take a look. Because they had just told me that I had IBS for months and months, and just, take some peppermint and it'll all be fine. So I woke up from that colonoscopy, And the gastroenterologist was like, well, I'm kind of surprised. You have what's called Crohn's colitis. And he's like, it's not even mild. Like, it's a pretty moderate case. So what they told me though, and what another gastroenterologist told me as well, was that here's your list of medications. You're going to be on these for a long time, permanently, until they don't work anymore. And then we're going to put you on some stronger medications. And oh, yeah, by the way, there's a 40% chance that you're going to need surgery to remove all or part of your colon. And I said, that doesn't make sense. You don't understand. I'm only 30 years old at the time. I just opened my own practice. I had a young family. I was like, okay, well, what do I need to do to actually get well? How do I need to eat differently? And he said, no. You don't understand. Your diet has nothing to do with this. Like, literally said that to my face. And
Yeah.
I hope and pray that all of your patients, I know they hear it from you, but I hope they know in the bottom of their heart that food is medicine. And just like food is medicine, food can also be poison.
Right.
So in my gut, I did not believe that, did not accept that.
Uh-huh.
And, functional medicine was still newer. It was for sure new to me. So I just went down all the internet rabbit holes that I could find on how to heal and get better. And as I did that, for one, I'm so thankful. I did take the medications because I was scared not to. And thankfully that put me into remission pretty quickly. So I could at least function and figure out how to heal. And then I did. I made lifestyle changes. I made diet changes. I started to feel much, much better, and eventually got off the medications and have not been on a single prescription in over a decade.
Wow, that's amazing.
And what struck me was that the Crohn's disease that I was struggling with was really just an inflammatory condition caused by a dysbiosis, an imbalance in my bacteria. And I just thought, man, isn't this exactly what I treat every day in my office? I treat tooth decay and gum disease. They're inflammatory conditions caused by a dysbiosis. It's just a different part of the gut. Your mouth is just the first part of your gut.
Right.
And so I just felt like I would be a complete hypocrite if I could heal myself of my own gut issues, but I couldn't figure out how to do the same thing for my patients. So that's what really led me into more naturopathic, more holistic dentistry. My patients really helped nudge me the rest of the way, because I don't know how functional medicine is viewed among your peers, if you got any pushback, but I know in dentistry there's definitely a lot of pushback, especially in the dental schools, where being a holistic dentist was not something that I wanted to be associated with. So it took my patients nudging me, like, okay, if you believe this thing, what are you doing with fluoride? If you believe this thing, what are you doing with all that mercury that you're drilling around? And so that's kind of that's the long story of what led me down the path and why I get to do some really, really cool, fun stuff now.
Great, great. Well, so some people listening may not really understand what holistic dentistry is, and how is that different than conventional?
So a lot of what's different is not actually the what. So I still do many of the same things that I've always done. We still do cleanings and fillings and crowns and partials and dentures and all of those things. But how we do it is much different sometimes and much more intentional. So We're very intentional with the materials that we use. There's absolutely no fluoride in my office, which is tricky because everything, like even every well-intentioned dental manufacturer finds a way to put fluoride in all of this stuff because we've been taught to believe that it's the best invention since sliced bread. So there's no fluoride in my office at all. I'm really careful with the types of composites and filling materials that I choose. I try to choose ones that are more biocompatible, that are, BPA free, as minimally invasive as possible. And then um we're really looking at a whole body focus. So we're taking the whole person into consideration. We're addressing their diet, their nutrition, the timing of what they eat, their microbiome, and we're actually looking at the bacteria that's in their mouth and how that's impacting them either positively or negatively. So it very whole body prevention focused. And that's really, those are some of the main differences.
So what's the name of that mouth microbiome test that you use?
My favorite right now is Bristle. I've
Mhm.
used a couple over the years. Oral DNA is one that's been around for a long time, and they do a really, really nice job. At the moment, I really like Bristle just because they cover a wider range of bacteria, and they'll even pick up if you've got an overgrowth of candida as well.
And then what do you do if you find that? Are there certain treatment programs you put people on?
Yeah, absolutely. So if we're finding, and we don't necessarily do the test on everybody because just like in functional medicine, the test has its own cost involved too. But if we're finding that things aren't as healthy as we want and we're not exactly sure why they're not as healthy as we want, then yeah, we want to test that saliva. And depending on where the imbalance is, will impact our treatment protocols. So sometimes it's in the office treatment and we're doing some ozone therapy. Sometimes it's switching up a rinse that they're using, trying to get them away from things that are alcohol based, away from things that are going to totally obliterate their microbiome, and towards things that are, in some cases very gentle, and sometimes we need something strong to knock out some of those bacteria. But we're careful with what those strong materials are. And then there are actually some probiotics that, some of the oral probiotics are specifically um, sensitive to different strain. Well, no, that's reverse. I said it backwards. There are some more detrimental bacteria strains that are susceptible to specific probiotic strains.
Okay.
The probiotics contain these bacteriocins, and the bacteriocins, depending on the type of bacteria, will help knock down some of those numbers too.
Okay. And then switching gears and talking more about mercury fillings and the whole, how do you manage that? I know there's something called the SMART technique.
Mm-hmm.
Can you explain like what that is and how you do that a little differently, maybe than a traditional dentist?
Yeah, well, from a patient perspective, I would say it's important that anytime you get one of those old silver fillings removed, that you have it done so safely. Because anytime, we know that if you apply heat or friction to those fillings, you're going to get some mercury vapor that comes out of those fillings. And we know mercury in those fillings, it has a half-life of 50 years.
Oh,
So, people used to ask, I myself used to ask when I was learning about it, well, eventually isn't the mercury all gone and you're just left with the other metals? But no, the mercury actually has a half-life of 50 years. And it starts out as 50% mercury. So that's a lot of mercury exposure. So anytime you brush your teeth, you grind your teeth, you chew, you have something hot to drink, you're going to release a little bit of mercury into your system. And most of the time, most people handle that just fine. But if I'm taking a high-speed dental drill to that filling, that's a lot more heat and a lot more friction. And so the opportunity for mercury exposure is much greater. So we want to make sure that we do that really safely. The SMART protocol is something that it's actually it's very easily Googleable. And you can, I believe the website is the smartchoice.org or the smartchoice.com, one of those, where you can see where they came up with the protocols, what the protocols involved. But it's basically, we isolate the tooth as much as humanly possible. We have special air filtration in the room so that you are exposed to as little mercury as humanly possible when we need to remove those. And then we depend on our functional medicine doctors really to make sure that we time it correctly. Because what worries me is when I see patients who are either not working with anybody or they're working with somebody who's not as experienced in heavy metal exposures. And they're doing these chelating agents, but then the naturopath or they either don't know that it's a big deal, that they still have all this mercury that's in their mouth. And so I think that as they're going through functional medicine protocols, that really helps us all work together to time it to where it's the most beneficial for the patient, to where we know that the patient's liver is capable and kidneys are capable of processing out toxins appropriately, that their gut can handle it. They're pooping normally. So the minimal exposure that you will get, because we can't eliminate completely, there's no way we could eliminate completely the mercury exposure, the effects of that are as minimal as possible.
And as part of that protocol, do you give some kind of binder or something so that when the mercury gets mobilized, it's immediately bound to something?
Yeah, we do an activated charcoal rinse before and after. And as long as they're not taking essential medications, then they can swallow it too, so that anything that's like the binder will be throughout the GI tract to pick that stuff up.
Okay, yeah. Well, that sounds good because I have some patients that I'll recommend getting the mercury fillings out, and then they'll just go to their regular dentist and they come back to me and I ask them, did they give you a binder? Did they do any? And they're like, no, they just took it out. And I'm like, oh boy. So
You get to
I try to make sure they know if you're going to get them taken out, find a smart technique dentist. And it should be listed, right? Is there a
yeah, there's a directory where we're all listed, and anybody who's SMART certified, we've had to do a case presentation. We have to show pictures of our office so that the organization that put it together, it's the IAOMT, so that organization at least knows that each dentist who they certify has the capabilities to do it the right way. They can't guarantee that everybody's going to keep doing it the right way. But you at least know that they have the ability, they have the setup there, they have the proper air filtration. But yeah, so, and to be fair to other dentists, granted, the first part of my career, I was taking those things out all the time, and just didn't know what I didn't know. But it's one of those things, like, yes, I assume that patients did fine, but also the patients didn't know what they didn't know.
Right.
And when I first started kind of tiptoeing my way into holistic stuff, and I had a patient who she was very highly sensitive, and had a lot of health issues that she was dealing with. And so we wanted to take the amalgams out, but I wasn't doing all of the protocols yet. I wasn't certified yet. I think I probably did, maybe half the protocols, because again, they look different and people make fun of you. And so I was scared to, it's silly stuff. It's silly stuff that embarrassment should make you not practice the way that you should practice. But that was the case. And so, because I didn't want to jump all in and wear all the spacesuit looking stuff yet, that patient that I worked on, she actually did. She went into a tailspin, and I didn't see her for about a month or so. And she didn't call me for whatever reason, which is crazy. But she said, when she finally came back to the office, she's like, I've been sicker than I've ever been in my life. She's had like this crazy, what she described as like explosive incontinence. I'm not exactly sure what happened. But once you know and can start correlating these symptoms to these events, then it makes it to where I will not ever remove a silver filling again without doing all the protocols.
Right, right. All right. And then just to transition to fluoride, I know there's a lot of controversy about fluoride in the water and whether or not we should get fluoride treatments at the dentist and use toothpaste with fluoride and all of that. Can you explain a little bit about the history of all that and what your thoughts are?
So fluoride was, and still it's a tool. And just like any tool, it has its pros and cons. Um, some people will argue that it is a natural substance. The way that we use fluoride is in no way natural at all. How it's typically, at least how it's added to the water supply, is a byproduct of pesticide manufacturing. It's nothing natural about how it's added. And it's, gosh, that's such a big topic. There are so many places that I can take it. What I would say is that while it is a tool that can decrease the rate of tooth decay, it is thankfully not the only tool that we have anymore. There are other tools. It starts with diet. Good oral hygiene is still important. Um, things like xylitol, toothpaste with hydroxyapatite, and we can talk about that stuff in a little bit too. Those are all really good tools where we don't have to use fluoride. And the newer research that's coming out on fluoride is really showing that it's maybe not as risk-free as we once thought it was. So there are a lot of studies, and unfortunately, most of those studies are in other countries, but some of these are really well done studies that are showing a really strong correlation between the fluoride levels in the water and IQ levels in children. And, if you go back 10 or 20 years, it used to be the conspiracy theorists, the tinfoil hat people, the Alex Joneses of the world. They were the ones saying that fluoride dumbs down the population and it lowers our IQ. Well, I'll be darn if some of the research is now showing that that is actually true. And there's a significant difference in these levels that have high levels of fluoride. A significant difference in the IQ. I think the most studied is with young boys. But the IQ of our children is really being impacted. So the amount of risk is, I think, understated, and we don't quite understand it. Where it gets really infuriating is really with the fact that it's added to our water as a medical device. It is meant, the only reason it's added to our water is to help prevent tooth decay. So Let me tell you, folks, that's a medication. That is a medication by definition. And your government, our governing bodies, have decided to give you this medication without your consent. And I know that Dr. Ingalls and I were both taught that giving someone a medication without their consent is wrong. So, full stop right there. It's just wrong.
Right.
So, not only are we all are being medicated without our consent, but we have no control over the dose that we're getting. So, they're putting it in our municipal water supplies at levels that they calculate and estimate are as safe as can be at those low levels. It used to be 1 part per million. Now I think it's 0.7 parts per million, or somewhere in that neighborhood. It's either 0.7 or 0.8. While that may be fine for you and me and everybody who's listening tonight, but what about the infant who's drinking formula, who weighs a lot less, but they're drinking formula out of a bottle, and that formula is filled with unfiltered tap water? How much fluoride is that baby getting? We have no idea.
Right.
No freaking clue how much fluoride that baby is getting. And then that same baby, if they're unfortunate or fortunate enough to be born in an area where they're depending on, like, let's say, a Medicaid office for their dental care. So they're getting who knows how much fluoride in their formula. They are eating foods, introduced to foods and drinks that are made and manufactured with municipal water. So they're getting more fluoride. And then they're going to a dental office that as soon as their teeth come in, they're slapping this really, really strong fluoride varnish on their teeth that they are going to swallow. I promise you, they are going to swallow it, and they're going to ingest even more. So I think the fluoride issue, it to me, it's an ethical issue. Yes, it's a tool, but it's a way overused tool that's way riskier than we thought. And so I think it's important for us to just kind of draw a line in the sand that we don't need it. We're not going to use it. We're getting it whether we want it or not. So I'm not going to add any other exposures to myself, my family, or my patients.
And do you find that people don't get cavities more or problems without the fluoride?
It's exactly the same. Exactly the same.
Well, it's funny because I have not had fluoride probably since before COVID, and I switched my toothpaste. I mainly drink filtered water. I mean, I'm sure I'm still getting some,
Yeah.
but I have not gotten fluoride treatments at the dentist since before COVID. And I told my husband that, and he's like, I can't believe you haven't had cavities. And I'm like, well, you're just kind of brainwashed. Like, I think we're all brainwashed that you have to have it because
Yeah.
we don't know anything different.
It's not a nutrient. It may be on the periodic table, but fluoride is not a nutrient. It is not needed for healthy teeth. And your teeth are some of the healthiest in my practice. So, no, it's definitely not needed by any means.
Well, and I know that fluoride can also interfere with thyroid function because
I was just going to say that.
it's
Yes.
similar structure chemically, and it can block thyroid. Is that right?
I
It can.
remember once, when I was a patient of Margaret Christensen, I know the first thing she told me was to get off the fluoride, because she said fluoride competes with iodine in the thyroid.
Oh, right. That's right. Yeah. So
And
that was when I initially got off it.
yeah, yeah. So no,
All
I think there's plenty of reasons not to, and now there are other alternatives. So you will not get more
right.
cavities if you ditch the fluoride.
Right. Okay. And then another controversial topic that I've never fully understood is root canals. And I know a lot of my patients have already had them. And so why is this such a controversial or confusing topic, and what are your thoughts about it?
It's what's funny is that I don't even know if everybody in the biological dentistry world is completely on the same page about it yet or not. Um, so I love the controversy. I think it stirs up really good conversations. There was a documentary several years ago called The Root Cause. It was on Netflix, and then Netflix took it down. I think you can still find it if you search the internet. Um, but it started great conversations. So when we have a root canal done, a root canal, it's not removing a tooth, it's not removing the root of the tooth, but what it does do is it removes the nerve, the part that's causing pain, um, within the canal of the root. Uh,
Mhm.
and I feel like I need like a diagram. I don't have one, but if you had a root canal, then you kind of know basically it winds up looking like this extra white little tube within the root of your tooth. That's because there's like a fake filling material where the nerve of your tooth used to be. Well, in that same canal is also the blood supply of the tooth. And so you've removed the nerve that causes pain, but you've also removed the blood supply because you have to. Um, that's what sterilizes it, or at least not sterilizes it, but disinfects the inside of the canal, helps reduce the inflammation, all that good stuff. But your tooth, all the parts of your tooth is really like a sponge. And so, even though you're removing the big part of the nerve and the blood supply of the tooth, there's still all of this spongy structure where there are all these little nooks and crannies and tiny little crevices where bacteria still live. And so, when you have a root canal done, then what inhabits all the little spongy parts of the tooth is no longer the normal bacteria that used to be there. It switches because since it doesn't have blood supply, the tooth no longer has oxygen. It's like this dead mummy of a tooth that has no way to breathe because blood flow is oxygen. Blood flow is life.
Right.
And so the type of bacteria tend to switch to these more oxygen phobic um, bacteria that sometimes, in some patients, in some situations, can mysteriously correlate with weird symptoms elsewhere in the body. And so that's where the controversy comes up because like any kind of toxic exposure, whether we're talking mercury or fluoride or root canals or mold or Lyme disease or any kind of toxic exposure, EMFs even, it it gets really hard for especially for scientists and physicians and people who do peer reviewed research. It's hard to get a direct correlation to you had this toxic exposure, which therefore causes this.
Yes.
But there are a lot of coincidences where the wrong person gets their bucket that they can handle fills up and things start to overflow. And yeah, people get sometimes after a root canal, they'll look back and say, I never had this X, Y, and Z issue until the year I had that root canal done. Uh, and then sometimes they will mysteriously get better if the root canal is then either retreated or removed or addressed some way differently. So that the reason it's controversial is because there's not agreement on it. It's hard to get good hard data behind it. But because there's enough of a correlation, I have some dentists, some biological dentists who feel stronger than I do about it. um, I see a lot of naturopaths who feel very, very strongly, and they will say, no root canal is a good root canal. They all need to go. You should never have one. Um, And I don't like to deal in absolutes because people are people and nothing is absolute. So I don't take that hard of a line on it. But I would say the conversations that we have in our office around root canals are much more in depth than you would have at a quote unquote normal dental office, when a root canal is treated as a no big deal way to save a tooth. Again, I think there are careful conversations to have around it.
Right. Okay. And then if patients listening to this or people listening start to have concerns about their own mercury fillings or their previous root canals or their microbiome, what would be the next step for them, or how could they get a hold of you or find a holistic dentist to address these things?
So there are, I would say, if yes, I think finding a biological dentist is a good next step. Now, if you can't get to one, if you're out in the country, it's just too hard to drive, then you can ask if your dentist has what's called a CBCT or a cone beam CT. It can help see those root canals in 3 dimension, and it gives you a much better view on whether a root canal looks like it might have some chronic infection associated with it. So that's a good place to start. Asking your dentist, again, I would say a conventional dentist, if they poo poo the fact that they're going to drill out an amalgam filling, to me, that's a hard stop. Um, I think it's just too risky. It's just too risky. But if you've had it done and you feel fine, then that's great. I would absolutely make sure that you talk to Dr. Ingalls afterwards, because I'm assuming she would probably want you to go through some protocols of binding what was released and help your liver clear things. When we're exposed to mercury, it likes to settle in fatty tissue and it likes to settle in organs, and one of your fattiest organs is your brain. So we want to make sure that you're working with your functional medicine doctor to make sure that you're minimizing the impacts of that exposure, because we all do things to expose ourselves to different toxins, and sometimes after we have toxic remorse afterwards. It's like a hangover, but with mercury or fluoride or whatever the case may be. So make sure if you've got that toxic hangover that you know how to detox from that. Now, if you're wanting to find a biological dentist, obviously I'm in Richardson. Would love to see any of you. I have an associate doctor who's at my office as well, who's fantastic. And so if it's taking too long to get in to see me, then because he's younger, he sometimes has less of a wait, but he's also fabulous. I know that because I've trained him myself. And then you can always go if you just can't drive out this way. And we have some people who will come and spend the night and stay at a hotel if they're having to drive too far. But you can always look at the website that I mentioned before. The IAOMT.org is the biggest organization for biological dentists, and that's a really good place to look at their directory, see who's closer to you. There are several of us in the Metroplex we all know each other. We all know that patients sometimes hop around to each of us, trying all of us out. So there's not a bad biological dentist in the DFW area. So I think that's something that's really special about this area too.
All right. And then for your practice, do you have any giveaways or programs or anything that you want to offer tonight?
Absolutely. Absolutely. So it's, again, would love to see any of you in my office, but the more we talk about these things, the more people that we need to serve. And that means we can't serve everybody because not everybody is in Texas. So I designed it for people outside of Texas who can't get to see me, or I'm not licensed in their state, but it's for anybody, including people in Texas. So I have a couple of online programs. One is just a do-it-yourself online course where you go through different modules, and it will help you and anybody in your household specifically around tooth decay. If cavities tend to be your issue, then it will help you figure out and eliminate those and really learn how to have the healthiest mouth possible. And then I also have taken that do it yourself course, and I have a live group program that I start every couple of months. Again, to really get to those root cause issues for those who can't get to see me in person. So both of those, I don't have the links handy, and I'm so sorry. I probably should have. But I don't have the links handy, but I will send them to Dr. Ingalls. And I would say anybody, why don't we set it up to where anybody who signs on for either of those programs within the next, how often, Dr. Ingalls, how often do you email your patients?
We have a newsletter every month and then several emails throughout the month. So
Throughout the month? Okay. So, and when will they get this recording?
probably in a week or two.
In a week
So,
or two. Okay. Then I will set it up where your patient, I'll give you guys a special code. Let's set that code now. Why don't we do Ingalls 20? We'll make it all caps,
okay.
Ingalls 20, and you guys will get 20% off any of my programs that we have online. I will send Dr. Ingalls the links so that she can get that to you guys. And I will keep it on. I will keep that on through June 1st.
Okay. That
Does that
sounds
sound
great.
good? Okay.
Yes. Thank
Okay.
you.
I don't want to give you too much time because then you'll think about it and then you'll be like, then you'll forget about it. So I've learned that deadlines work for me and for other people too.
Yes. All right. Well, thank you so much, Dr. Tony. This was great having you. And I think people probably learned a lot and opened their eyes to a lot of things that we didn't know. So thank you so much.
You're so welcome. Thank you for having me.
All right. Have a good night. And I will send out the links later. So take care.
Perfect.
Thank
All right.
you.
Bye, everybody.